What we've kind of worked towards to lead to this presentation is we've had myself and Latoya from our SCOE, School-Based Mental Health and Wellness Program, present it briefly on our model and how we work with the FQHC here in Sacramento. And then at our COP last month, Alameda County Health presented their amazing model that they're doing with their FQHCs. So we wanted to kind of continue that and bridge this gap. And particularly this outreach to Sonoma came from the breakout room from that COP, where within that room there was a lot of questions of like, how do you actually start this? Like there were several COEs that were like, we're really interested in exploring this as an option, but we still aren't really sure how to begin this. And so it was so perfect that Sonoma, y'all were really willing to kind of present and show us how you're starting this work because you're still really in the beginning stages of partnering with your FQHC. So excited to have Sonoma here to present, and I'll pass it off to y'all.
Great. Hi, everybody. Good to see you. Thanks for having us today. I'm Tyson Dickinson, director or director in the Behavioral Health and Wellbeing Department at Sonoma County Office of Education.
And hi, I'm Maura. I'm also a director in the Behavioral Health and Wellbeing Department here at the Sonoma County Office of Education.
All right. I think the slides are going to come up soon. Yeah, we'll talk a little bit about our journey. So you want to start us off, Maura?
Yeah, so we're going to share our very early stages of our journey with an FQHC. So here's our agenda for today, just kind of where our FQHC journey is so far, some learnings and takeaways that we gathered so far in this journey, and then just what are our next steps in terms of partnering and maybe expanding things, and any time for questions.
All right. So our journey so far in Sonoma County, I'm going to go back to the 21-22 school year. That was the first year that we actually had a department. We had a department in our county office focused on mental health and well-being. So prior to that, we really weren't able to support our districts in the best way around mental health and well-being. So we started the department, and the next year in, I believe it was September 2022, a few of us were at the Student Mental Wellness Conference in San Diego, and I saw a presentation about schools as center of wellness by Sacramento County Office of Ed. And when I was kind of preparing for this presentation today, I went back and found the email that I sent to Chris Williams, and I think I had Alex Briscoe on there, and I was like, what is all this stuff? Tell me, what's going on with schools as center of wellness? How do you get this FQHC funding and blah, blah, blah. And so that's kind of how it started. And from there, they suggested coming to some of the Center of Wellness convenings that they held in Sacramento. So I went to a few of those, maybe more than a few. There were actually some jokes about how many of those I was attending. I don't think it quite hit stalker level, but it was getting there. And we were bringing more of our team members and just really trying to learn about the model and develop relationships with the folks in Sacramento, who obviously have a lot of knowledge and expertise in this area. So, and about that time in our department in Sonoma County, we were really focused on opening wellness centers on school campuses in Sonoma County. There was only one wellness center on a school campus in 2021, 2022. So we were focusing on the high schools and trying to help districts and school sites open wellness centers. One of our local high schools was interested in opening a wellness center, and we realized that they already had a health center on their campus. And we kind of made that connection. Wait, is this one of those FQHC situations that Sacramento was talking about? So we worked with them on kind of merging the health center and district staff and create a wellness center. And not right away going into the FQHC funding reimbursement area, but kind of talking about that, but really spending a few years just on workflows and partnerships and how they're going to work together in this wellness center on that campus. So we were doing that for a few years, and in the meantime, we were really focused on growing our relationships with that FQHC, with other FQHCs in our county, with CBOs, community-based organizations throughout the county. So a lot of focus on that, which is something that was emphasized heavily by Sacramento County Office of Ed. And I have to say, at this point in time, I'm really glad we focused on that. Let's see. So fast forward to the start of this school year, we felt like, okay, it's now or never to start thinking about sustainability, and not just keep relying on these grants and other things that are coming, because they're going to stop. And in my opinion, the further we get from the pandemic, the less often leaders and administrators talk about mental health. And so we partnered with Innovative Strategies Group, which comes from Sacramento, and specifically has Chris Williams is on that team who was previously with Sacramento County Office of Ed. And Butte County Office of Ed is also partnered with Innovative Strategies Group. So we started working with them around, okay, we're really interested not just in the FQHC piece, but in the whole schools as centers of wellness model, because there's more to it than just reimbursement through the FQHC. And they really encouraged us to not kind of like go big and announce some big Sonoma County Schools as Center of Wellness initiative, but find existing opportunities. So through our relationships with the FQHC that I referenced earlier, we learned that there was a school site that they had already designated as an FQHC that was in need of a clinician. So we reached out to kind of the leadership of the FQHC and talked and said, we have a clinician that's ready to go. We talked about the model a little bit more. They'd already been introduced to it. And we discussed having a proof of concept and that this is something we want to do and do it in a way that is replicable. And they were very interested in that. And so right now we are getting our folks paneled, and we have a couple opportunities right now to start billing through the FQHC at some point this school year. All right, next slide. So just some of the learnings and takeaways so far. And I referenced this earlier, but just that relationships are huge in this, as you all probably know. And that has gone a long way. It's made some of these conversations around, hey, can we do this? Go faster, because the people we're working with already know why we're doing it. We have shared values. I'm gonna talk about that in a second again. We took our time to understand the model. Now there's a little bit, we took our time to understand the model, which I think is very important, but we aren't trying to answer every question or figure out every detail before getting started. There is this kind of idea of like, you got to get going. But it was important for us to understand, and for our partners to understand, that a backbone organization like a county office is kind of crucial in this model. Districts doing this on their own, it can be a big challenge. And it's not just about the FQHC billing and the reimbursement. So it is about this whole schools as center of wellness model. Once again, about like finding the partners, people who are thinking countywide, people who want equitable access to mental health services in schools, and who are a little bit willing to take a risk. And then finding the right kind of support to do this. So really looking for people who want to walk alongside us, who want to understand our county, and who fit well with our team and have some of those shared values. So those are some of the learnings and takeaways that we've experienced over the last few years. I think next slide is you.
All right, so these are some of our next steps in our partnership. So we're in the development of developing and signing contracts with our current partnering FQHC and designating a school site. Another one, we're beginning the paneling process of 2 of our county office licensed clinicians, and one of them has actually started integrating into the school and they're providing services, and they'll do some billing like on the fee schedule for a bit until handling is finished. We're working with the FQHCs to develop and adopt policies and practices for our model as schools of center wellness and how things will work, and make it so it's replicable to other school sites and other FQHCs. We've started speaking with the second LEA, and they seem like they want to go for it. So we're kind of taking the next step in that process and working on getting that one designated as an FQHC. We're collaborating with our FQHC to become affiliated providers on the fee schedule with partnering LEAs. So we're working with them because it's not the same amount of reimbursement, but it does open the door to some private insurance and things for them. So they're excited and curious about that, and are trying that out with a number of the LEAs in our county and in our billing consortium. And then we're beginning to reach out to other FQHCs. So we have 8 FQHCs in our county that are independent, which is a little bit different than what Sacramento has, which is the county one. So we're going to kind of start reaching out to some of them because they cover like different regions within our county. But that's kind of like our next steps in the next few months that we're working on. And then I think we'll do questions at the end. But thank you guys for listening and hearing, and we'll keep you posted on how it keeps going. But thank you.
Thanks, Maura and Tyson. Gratitude for you, and appreciate you sharing your learnings. That was great. And I'm just going to stop the recording. And then for folks that maybe